The data you're talking about, this elusive data we've heard a lot about, can you tell us what metrics you're using?
Thank you, Mr. Chair. The metrics that we use, there's not one specific metric. It's really a number of factors that we're looking at. When I look, for example, at the situation when the vaccine mandates were first put in place, at the time there was strong scientific evidence that the vaccines were preventing infection and that they were working against transmission, against Delta and Alpha, and protecting against serious illness. There was rapid acceleration of the Delta variant. Hospitalization and ICU rates were very high, and the modeling was showing a strong resurgence at the time. When we look now, comparatively, we have high immunity, both from vaccination, but also from infection rates. We have significant availability of antivirals. I mentioned the vaccination rates. Over 82% of Canadians are fully vaccinated with a primary series. We have lower hospitalization rates, and we're effectively in a better position now to be able to manage the pandemic. And that's why the decision was made to remove the vaccine mandates for public servants, but also for the domestic transportation federally regulated sectors.
And I guess the question is, as we've asked multiple times before, we would like you to table that information with those metrics here with this committee. So since you have it at your fingertips, that'd be great within the next 2 weeks, please. That being said, we talked about vaccine effectiveness. Certainly we know that the vaccines that are developed are against the original variant. With new variants of concern and vaccine effectiveness waning over 6 months, the health minister talked briefly about 3 doses being a fully immunized Canadian. Does it make sense to continue to use these old vaccines?
Thank you, Mr. Chair. Mr. Chair, the Minister of Health, Minister Duclos, did indicate last week that that primary series is going to need to include 3 doses, but we do know from the vaccine science that vaccines continue to be very effective, particularly against fighting the severity of the virus. There is also some protection offered in terms of transmission, but we do know that unlike Delta, that it does wane over time, but the vaccines are still very effective to prevent severe illness and death. So in terms of the vaccines, we continue, and Dr. Tam, the public health officer, does continue to encourage Canadians to be up to date in terms of their vaccination. It's still the best protection that's available to Canadians.
I understand that. I guess the question is, since we know that it is really not preventing transmission, and we know that even the Prime Minister has had 3 doses of vaccine, has had COVID twice. I guess I just, and this is more of a comment than a question, it really befuddles me how you could possibly require Canadians to get a 3rd dose of that particular vaccine. That doesn't seem sensical to me. It seems nonsensical, in fact.
And talking about the travel mandates, this is an issue that has affected a lot of people in the riding I represent. And I know that, several of those measures have since been lifted. But at the same time, people are frustrated by the lack of explanation as to what the criteria were and how the decision-making process worked. So I'd like to start by going back to earlier in the pandemic when the vaccine became widely available and the government chose to put the vaccine mandate for domestic travel in place. So these are rules that prevent unvaccinated people from traveling on airplanes and trains within the country. Now, Ms. Thompson, could you speak to how those rules were designed to work? I mean, I'm trying to get at the heart of this. What is the mechanism or what is the specific risk that was being managed when those rules were first brought in?
Thank you, Mr. Chairman. With respect to vaccine mandates, as I mentioned, the national but also global epidemiological situation was very different than what we have today. There was modeling that showed possibility of strong resurgence. We were in between Alpha and Delta variants, and while we did have a high vaccination rate even back then, there were pockets and subpopulations that were not vaccinated, including younger people. Younger individuals. And so at that time, the government made the decision to increase the uptake of vaccines with the vaccine mandate to offer some additional protection and ensure that, particularly with respect to travel and small conveyances, to ensure that there was additional protection through the vaccine mandates at the time.
Oh, can I take it from your response, Ms. Thompson, that the key objective of the vaccine mandate for domestic travel was to encourage Canadians to get vaccinated, as opposed to preventing transmission in a travel environment?
It was certainly to encourage vaccination, but at the time we were also looking to protect Canadians from COVID, from severe illness, from hospitalization, and there was very strong evidence to show that the vaccines were very effective for all of those risks that we were facing at the time.
Take it from your response that reducing transmission in a travel environment, that is on an airplane or on a train, was not one of the original objectives of the vaccine mandate for travel?
Mr. Chair, the objective of all of the measures that are in place is really to protect Canadians and the health of Canadians, and in particular people that are vulnerable, immunocompromised. So that is the first objective in all of these measures, in addition to promoting vaccines, because we had good evidence that vaccines were very effective, particularly against Alpha and Delta, and because we knew that there were some regions of the country and some populations where we didn't have the protection that we were looking for.
I'm failing to see it. I thought I understood the mechanism, which was that if you're unvaccinated and you're carrying the virus, there's less chance of you transmitting it to people around you. I think that's how most Canadians understood those rules to work. And in addition, there's this piece around trying to convince people to get vaccinated. But the piece around transmission is particularly interesting because of what we've been told about how the virus evolved and the changing impact on transmission. So I'm looking for something here because I'm not clear on how these rules were supposed to work.
Thank you, Mr. Chairman. Certainly, we want to be as clear as we can with Canadians, and Dr. Tam always makes sure that during her briefings that she communicates to Canadians what the situation is in Canada, as well as do other departments that have imposed measures, whether it's Transport Canada for a domestic vaccine, for federally regulated sectors, or Treasury Board for public service. And so, Mr. Chairman, just with respect to the federally regulated sector, as I indicated, there was strong evidence from international and domestic sources to conclude that vaccines were very effective at preventing infection and consequently transmission against the COVID variants that were circulating at the time, namely Alpha and Delta, and as I said, protecting against severe illness and hospitalization and death. And that is one of the reasons why we were indicating that the evidence was there to support a vaccine mandate at the time.
Thank you, Ms. Thompson.
Continuing with questions regarding the vaccination mandate for domestic travel, there are two government decisions that are of particular interest. The first was the decision on June 1st to extend the travel mandate, and the second was the decision 2 weeks later on June 14th to lift the travel mandate. Were both of those government decisions consistent with advice from your department?
Thank you, Mr. Chair. Of course, I can't speak specifically to advice provided to the government, to ministers as part of the cabinet process, but I can say, as I've stated before, that the science and the assessment of the Public Health Agency supported the decision to lift the vaccine mandate. We, as I said earlier, appreciate that it's also required on the part of the government to be able to appreciate and consider the information that they receive from different sources, and so
did the evidence that your department collects also support the decision on June 1st to extend the mandate? You spoke to the lifting of the mandate. Did the evidence you were collecting and the science you were reviewing also support extending the mandate on June 1st?
Mr. Chair, as I said, we are constantly reviewing the studies and the evidence and the information that's provided to the government is consistent with what we were seeing at the time when the mandates were being lifted.
We talked about the lifting already. We're talking about the extension of the mandates now. I'm just frustrated because I'm asking different questions, but you're giving the same answer to every question. And what I want to know is whether the information you were looking at PHAC was supportive of extending the travel mandates on June 1st.
Okay, Ms. Thompson, that was the last question. You won't be interrupted. Take as much time as you need to answer it.
Thank you, Mr. Chair. Mr. Chair, I don't mean to repeat the information, but I can only share with you that the evidence fully supported the decision to implement the mandates. With respect to the timing, as I say, the evidence is constantly evolving. New studies are coming out. Dr. Pelican was talking a moment ago about a study a few days ago on long COVID. So the information is it's very fluid in this pandemic that we are all living, and we're constantly considering and reconsidering the data. And what I can say is at the time when the government lifted the mandate, that the public health evidence supported lifting of the mandate.